Hello, my name is Sean Park, a prosthetic urologist practicing in Seoul, South Korea. My main specialty is treatment for erectile dysfunction, especially surgical methods. Today, I'm going to talk about treatment options for the ED, which is I will cover about the injections. When the patient doesn't respond to the pills generally, we move over to the injection treatment. AUA guideline clearly states that patient can choose whatever method they prefer when it comes to ED treatment, regardless of the invasiveness, which means that if the patient wants, they can take pills or injections or surgery, doesn't really matter. So patients usually are the captains. We are more like navigators. So we tell them how to go further and they choose what they want to do. Some of you may know, but I went to the US to get trained by the legendary surgeon, Dr. Stephen Wilson, who is a pioneer in my field and erectile dysfunction treatment as well. Anyway, why do I talk about him? Because there's an interesting story with the injections. When he attended the, I believe it was some southern part of the AUA meeting or something like that, there was a doctor who showed up and claiming that he found an injection which can have the erection back. Everybody was excited because they didn't know about it. And it was his turn to talk about that subject. And during the talk, he said that before I came here, I injected it myself. And he showed his erection to the urologist in the room. And he even let them touch it to show that he had a good erection. So Papa Wilson told me about this, and that's why I clearly remember about that story. So injection was not developed before the other treatment methods. But anyway, nowadays we use, in South Korea, we mostly use a Triix, which means that we mix 3 drugs. The reason why is that each of the drugs are vasodilators, which will have a more blood flow to the penis. But if we use only one drug, it has more side effect than the others. In fact, all these 3 drugs has more like an acidic. It's not neutral. So they can cause some fibrosis or the scars inside of the corpora. So if we mix it, we can, decrease the toxicity if we just only use one drug to make a good erection. But however, it can't really prevent a scarring effect in the corpora. I believe other countries has a different condition, but at least in here, we doctors can make a formula by ourselves. And when we mix it, the drug should be kept in the cool, like a refrigerator. Also, you can't expose it to the sunlight. If it is exposed to sunlight in a room temperature, it will lose its effectiveness within 30 minutes. So that's the reason why injection is somewhat more difficult to use, because it will limit, its usage. You can't really put it in your pocket and keep it, take it around. And even though we make it in the best way, it will be only effective for 2 months. Generally, these drugs are for those who have a stable relationship, like when they're married or they have same partners. Injection shows a better effectiveness when it comes to when the pills even doesn't work. So it can be a good option for them. But actually, even though you use an injection, because of its scarring effect and the other reasons, the dosage will increase over the time. And there's a maximal dosage with the Triix, generally it's a 0.6 milliliter. Then above that dosage, drug will have a ceiling effect, which means that it will not produce a better result, rather it will cause more harm. But there's a chance that if the patient is more susceptible to the acidic injury, then it can cause some scarring in the penis and it can have a curvatures or it can make the penis smaller. The other thing you have to know is that if the erection lasts more than 2 hours, that is really a dangerous sign. There's a term Priapism, which means that a patient has a prolonged erection. Well, if the erection is become longer than 4 hours, no more fresh blood will go into the penile corpora, and the corporal tissues will have a necrosis, which can make the patient permanently impotent. So if you have a longer erection than 2 hours, you have to contact your surgeon or the doctor who prescribed it, or you have to go to the emergency room right away to get a treatment. Generally, we prescribe the antidote for this condition as well, but in some cases, this antidote doesn't work. And especially those sickle cell anemia patients, I strongly advise not to use injections because they have more prone to have a priapism. But overall, it's a pretty safe and fairly, effective method. But for me, generally injections are to buy some time. Not really dependable treatment options for a long duration. So that's how I see it. But depends, you know. In your case, it might be working, but in some cases it doesn't. So this is a summary of the injection, and hope this could help you to get a proper treatment for erectile dysfunction. On next session, I'm going to keep talking about the erectile dysfunction treatment options.